chatted about it.
Yeah.
Are we ready? Good evening and welcome to this Facebook live broadcast to smear the myths and share the facts during cervical cancer prevention week. We have a panel of expert clinicians as well as patient ambassadors who are going to answer questions you may have about screening. My name is Kath Lewis and I work within the public health team in NHS England in Lancashire and South Cumbria and have been involved in cervical screening programme for many years. With me we have Mr Nick Wood, consultant colposcopist and gynaecologist at Lancashire Teaching Hospitals. Ruth is the reception manager here at Library House Surgery. Liz was diagnosed with cervical cancer at the age of 29 and wants to share her story to encourage women to attend for screening, and she also volunteers for Joe's Cervical Cancer Trust. And Hayley has just recently been for her first screen and she's going to share her experience. In the background we have Kerry and Michaela who are going to take any questions you want to send in and we'll answer those later on. The purpose of this event is to smear the myths and share the facts of cervical screening and HPV, which is the human papillomavirus. We want to talk about why it's important that women accept their invitations for screening, and throughout the evening we have a team available to answer your calls to make an appointment for screening if you've had an invite letter and not yet made your appointment. The number to call, which is on the wall behind us, is 01257 514056, and the lines are going to be open till 9 o'clock this evening. We are running this event as the cervical screening across the country is at an all-time low, especially in certain groups, particularly younger women aged 25 to 35, women from ethnic minority backgrounds and women who identify as LGBTQ and those with a learning disability. Cervical screening prevents around 4,000 women going on to develop cervical cancer in the UK each year. The aim of the cervical screening programme is to identify those at high risk of developing cervical cancer so they can be monitored and treated well before any cancer develops. The screening now looks for high risk HPV, which if persistent can start to cause changes in the cells of the cervix, which if left untreated could eventually develop into cancer. At some point in our lives, around 4 in 5 of us will at least get in contact with one type of HPV. And in most cases our immune systems will clear it, but in around 90% of infections will clear within 2 years. HPV infections don't have symptoms, and so you probably won't even know you've had it. It lives on our skin, so it's easy to get and very difficult to completely protect yourself against. And we can have HPV for a long time without knowing about it, so it's hard to know when we get HPV who we got it from. Before we start the questions which have been sent in, Ruth is going to explain the process of contacting your practice to make an appointment.
Okay. You can ring your practice when they're open, or you can book through your practice online on their online access of their app. And you can book an appointment here tonight by ringing 01257 514056. It's really easy to make an appointment at your GP practice. We've got staff waiting to take your calls this evening. If you don't want to phone this evening, call your practices tomorrow. If you've had your letter and you're due your screening, please give us a ring.
Thanks, Ruth. Liz has kindly agreed to talk about her experience of being diagnosed with cervical cancer.
Yeah, so I was diagnosed literally just a year ago on the 14th of January last year. I went for my second routine cervical screening test. My first one I had at 25 and it was all clear and fine. When I was 28 I was pregnant with my daughter, so I was unable to attend, but my GP just said just come as soon as you're able. So I did, and unfortunately I was in a very, very small percentage of people that actually my cervical screening picked up a cancer diagnosis rather than a prevention. It was quite an aggressive one. I'd only had it a matter of months, and I was diagnosed on the 14th of January. But everything was in place. It all happened very quickly and very smoothly. I had a very minor surgery to get a cone biopsy to check exactly what was going on with the tumour, and then I had to wait 4 weeks for my cervix to settle down before I had an MRI scan to determine what stage I was at. So I had the MRI scan at the beginning of February. and it was decided that due to the severity of the tumour and the aggressive nature of the tumour, I had what's called LVSI present, which meant that if any scrap of cell was left behind from the tumour, the chances of it recurring would be very high. So the decision was made for me to have a radical hysterectomy. So obviously at the age of 29 with an 8-month-old baby, it was a massive blow to hear, as my husband and I had always dreamed of expanding our family and having more children. But the fact of the matter is that I had a daughter who was healthy and amazing. I went for my cervical screening, it got caught early, and I did the right thing. So we went ahead and had the radical hysterectomy on the 1st of March, which unfortunately had a few complications later on, which were completely irrelevant to the cancer itself, to be honest. Nick knows very intimately about what happened with that. But amazingly, on the 14th of March, so literally 2 months from diagnosis, from the 14th of January to the 14th of March, Nick gave my husband and I the amazing news that I was now cancer-free. So yeah, and here I am. So even though I had a very rare case in terms of, unfortunately, my cervical screening didn't prevent my cancer, it did find it. I'm still here. It was caught early and I did the right thing and I went for my cervical screening. Had I not gone for my cervical screening and I just sort of pushed it to the back of my mind, or, you know, oh, I will call, I got my invitation, or I'll ring them up whenever, had I left it a matter of months, it would have been a really, really different story, completely and utterly. And I'm very grateful for everyone involved. So yeah, here I am.
Thank you, Liz. That's really nice of you to talk
Thank you.
about.
No
that.
problem, it's my pleasure.
Nick's now going to talk about his work as a colposcopist.
Yeah, so so the cervical screening programme clearly starts with that process of inviting women to have their smears, and so that starts when a woman's 24 and a half. They're identified and invited to attend for screening, and so they will have their screening around the age, you know, before or after the age of 25. And then if the screening is negative, normal, they'll be invited to have smears every 3 years until the age of 50, and then every 5 years until the age of 65. And if everything has been negative in that time, that will be the end of their screening. So in only the minority of smears are reported as abnormal that need further investigation, because a smear is a screening test. It's not a yes and no test. It doesn't make a diagnosis. It just says you should look a bit more closely to see if there's something here that might need treatment. And as Liz said, that this is about identifying usually changes which are precancerous that can be treated to prevent cancer from forming. And broadly, if there is an abnormal smear, it falls into two categories: a kind of a lower risk group and a higher risk group. And in the lower risk group, the milder abnormalities, of those smears, only 20 to 30% will need something done, will have an abnormality that might progress into cancer. Of the higher grade smears, 9 out of 10 women will need a treatment. So there'll be an abnormality there that will need treatment. So those women are referred to the colposcopy clinic. And the colposcopy clinic is, in essence, the ability for colposcopists, and colposcopists can be doctors or nurses, so male or female, male nurses and female colposcopists, nurse colposcopists and female doctor colposcopists. So so you're invited to the clinic. The clinic consists of us looking at your cervix under magnification, so using a speculum in the same way as when you have a smear to look at the cervix. And the majority of colposcopists should also provide the equipment that if you're interested to look at your cervix to see what we're looking at, you can see it. Okay, you can see it in full HD, which is useful to explain away, because despite everything that I will say tonight and everything that's contained in the information leaflets, people are very worried and think that they're going to be that tiny minority that has a cancer. And so it's quite good to demonstrate that to people, to say, look, to the naked eye, your cervix looks normal, which means that it's like, you know, the chance that there's an actual cancer here is very low. And so the difference between attending colposcopy and attending for a smear is that the colposcopy clinic has a very gynecological couch. So a couch where, you know, where your bum and feet are supported. And in the room there will generally be 2 nurses with me when I'm doing the colposcopy, and you're on a reclining chair. We pass the speculum as if you were having a smear. The colposcope is really a set of binoculars and a light source. Okay, there can be fancier ones, which are video colposcopes, and we use 2 different coloured fluids to look at the cervix, and the fluids help highlight potential areas of abnormality. And the outcome of what we do in the colposcopy clinic really will be based upon what the referral smear was. You know, is it a low risk of there being a problem or a high risk of there being a problem? And if there's a high risk of there being a problem, if you're in that kind of 9 out of 10, you might need something doing, we'll often talk about doing the treatment on the same day. So we'll speak to patients and say, there's a 9 times out of 10 risk that we should be doing something here. If you want, I can do that treatment for you today, if I'm convinced that's the situation, and that will involve putting some local anaesthetic in the cervix. So this is the point where I explained that, you know, I know you were already anxious before you came in, and I'm going to put you on a very gynecological couch, which will make you feel a bit more anxious. And I'm going to talk to you about putting local anaesthetic into your cervix. And some of the medicine in that local anaesthetic actually makes your heart beat a little bit fast. That can make you feel even more nervous, okay, and anxious. But you know it's going to happen. You know your legs will tremble a bit because that's the medicine as well, not just you shaking, and it settles down, okay. And you've got someone to talk to, and you know that if you're uncomfortable, you don't want it to happen, you can say stop and we can think about other ways of doing it. But generally, even with the high-grade abnormal smears, 7 times out of 10 in our clinic at Preston and Chorley, you can have your treatment on the same day, and it's very well tolerated. And we talk to you about the potential risks. There's a small risk of bleeding, there's a small risk of developing an infection, and there's a small risk that women who have multiple excisions of the cervix, who may need more than one treatment, it may have an impact on future pregnancies in terms of increasing the rate of caesarean sections and increasing the rate of premature delivery. But generally, within 20 minutes, you're sat in the recovery area having a cup of tea and a biscuit. And if we don't see an abnormality that needs treating, or if you don't want to be treated in the clinic setting, or want to wait and have the result confirmed, then we may need to take a biopsy. And if it's a low grade abnormality, I may tell you on the day that I think your cervix is normal, and that this has been a false positive screening smear, and that my ability to exclude disease at colposcopy has a very good, what we call a negative predictive value, very good for me saying it's not there. The chance of you developing an abnormality between now and your next smear in 3 years' time is minuscule. So I'm very confident to discharge you back to your GP, or to say have a smear in 12 months, or to say I think I should take a biopsy and let's see what this is. And you may need a treatment subsequently. Or the thing about this is that the causing agent is the human papillomavirus, so a virus that we know that your body's fighting, and every second of every day there are things trying to turn the cells of our body cancerous, not just in the cervix but everywhere, and our body is permanently repairing things and fighting things off. So your body's very good at trying to prevent that from happening. So even when the process of precancerous change starts in the cervix, if your body gets rid of that HPV, gets rid of the human papillomavirus, that process can go back to normal. So we know that some precancerous changes will go back to normal just by waiting. So without putting a scar on the cervix, without doing that. So you can just watch and wait and let things go back to normal in certain situations. So yeah, the thing I tell the patients who've come to colposcopy and have had treatment, if they need it, is please go tell your friends we're not as bad as all that. You know, you get a cup of tea, you get an NHS biscuit. We try and make it as friendly and take the stress out of it. That's colposcopy.
I think as well, Liz has already said her situation was fairly rare for you. Most of the people you'll see, I'll just be
absolutely
go back to
absolutely, and there will be times. So generally, what we say is that if I see a cervix which I have a high suspicion that might be a cancerous process, I'll say I have a high suspicion there's a cancerous process.
At my colposcopy, before I even went in, I had a diagram drawn, we had everything, and obviously we were unsure and we were anxious, but we were told we're going to need to do this cone biopsy and a loop excision. So we already knew that was happening before we'd even gone in for the colposcopy, and that was just from the cervical screening results. Yeah. So before I'd even had the colposcopy itself, so we were pre-warned. So
I think that there's if you have a high suspicion, I'll say, look, I'm worried this might be cancerous. I'm going to get this processed urgently. I want you back here in 2 weeks so we can get this sorted out and get things sorted. But if you have a biopsy and I say, look, this is a precancerous change and we're going to treat it today, or I just need to have a biopsy to know what to do here, I will say, look, you'll have a letter from me within 4 weeks. That's the standard I'm working to get this letter. We'll have the biopsy result back, I need to do a letter and get it out to you, and if you haven't heard from me within 4 weeks, then phone up and moan about me, because that's the standard we work to. So you get your result and turnover quickly.
Yeah. I think as well, when you go for screening, the result is graded. So if you're low grade, you might wait a little bit longer to go to colposcopy, but certainly if you come back as a high, the suspicion is a high grade, you're in.
If your high grade smears are treated, you will hear about the cancer pathways. People talk about 2 week wait referrals. If people have red flag symptoms for whatever type of cancer, you talk about kind of a 2 week referral. Well, the high grade smears are viewed as a 2 week referral, so that's how they're treated through the process.
But it doesn't mean you've got a cancer.
No.
In most cases you haven't.
And in fact, with all of those, all of that guidance about early detection of cancer, the threshold for the flags and symptoms, the threshold that's needed for that symptom or feature to be included in an urgent referral is only 3% there's a likelihood to be a cancer here. So there's a real push. So the benefit is that we're hoping to detect things earlier. The downside is that potentially 97% will be a false positive. Yeah. So lots of the screening we do has a much better, has a higher pickup than that. Yeah. So, but it's the majority of people, of women who have their smears are healthy women with no abnormality. Yeah.
Just like to remind you that the telephone lines are open. They're open for anybody from any of the surgeries watching this to ring, and it is 01257 514 056. Give us a call, book your smear.
Thank you. So Kerry, who's behind the other side of the camera, has got some questions.
Yeah, so just a huge thank you to the panel really for doing this Facebook Live event. We've currently got 70 people watching through the Library House surgery, so we envisage that there's lots of other people watching it through the other avenues of Facebook. So the first question we've had in is for Hayley. So how did you find the cervical screening process, and what made you attend when you were invited?
So I didn't actually book my appointment straight away. I went for another routine appointment and they reminded me that I hadn't been for my cervical smear, so I booked it. When I went for my smear, I think the worst part is it's a little bit embarrassing. I think that's the worst bit. It's not painful, it's a bit uncomfortable, but I just kept reminding myself that people are doing it every day, so they see it all the time. And everything was fine. My smear came back clear, and I've told loads of my friends to go for theirs because most of them haven't been for theirs actually, and I have told them that they should go for it because it's nothing to worry about.
And I think that's the thing, from a nurse's point of view, which is my background, is we're not looking at you. All we're looking at is your cervix. We're not interested in whether you've got matching socks or not. We've been for bikini wax. We're not really bothered.
But yeah, that is. I think that's the worst part of it. Is it's a little bit embarrassing, but.
But you work in the beauty industry, don't you?
Yes.
So I guess you've done waxing, haven't you?
Yes.
Right, and women are quite happy to be waxed.
To be waxed, yeah.
By a non-medical person.
Yes.
So
yeah.
get your smears booked, girls.
Yeah, definitely. Yeah.
It's definitely not as bad as waxing.
No, it really isn't. It's quicker.
I'll take your word for that.
Okay, thanks for that, Hayley. So we've got a couple of questions that I think we'll direct to Nick. So the first one is, why do I have to wait until I'm 25 to have my cervical screening?
Okay, so this is all about, there's a couple of things there. First of all, there's no evidence that starting screening before the age of 25 will detect more cancers and save more lives. And that's evidence from England, but you may know or not that screening actually in Scotland and Wales starts at the age of 20, and that's because they didn't change from the age of 20 to 25, and that change has been resisted. But there has been no evidence thus far that screening earlier will improve outcomes. And the other thing is that as I said earlier, that the abnormality, the virus that causes the abnormality can resolve. Our body will generally treat it. So at the age of 20, we are generally closer to the point that women have first had intercourse and first been exposed to HPV. So there'll be a lot more women who will be false positive. So they may have high risk HPV, may have minor cell changes, but will never have gone on to develop precancer or cancer. And the risk is that you start over-treating and over-investigating, so you're making people anxious unnecessarily, is one thing. But the second thing is if you start excising bits of the cervix in women who would have never gone on to have precancer or cancer, then you are potentially putting their future pregnancies at risk with no benefit. So that's and what we're not saying is that there are no cancer diagnoses before the age of 25. That's because we know that there are. But what we're saying is that using the screening system as it is currently will not improve the outcome or reduce diagnosis and deaths from cancer as a consequence. And one of the most important things to recognise is that in women who are diagnosed before the age of 25, often they've had symptoms that haven't been reported or appropriately investigated. So they may have gone to see a doctor or a nurse, but they haven't been examined, and the chance to intervene at an earlier stage has been missed. So there has been a big kind of education and training to the medical community to say, look, that age group, abnormal bleeding, whether that's bleeding after intercourse or bleeding unexpectedly between your periods, then if that's happening on more than once, you should go and have a discussion and a chat with your GP or practice nurse and be examined. And the majority of cases are that it's something normal, or the most common cause of irregular bleeding in that age group. Maybe you need to rule out infection, so it's important to be investigated.
Okay, thanks, Nick. So the next question, or a couple of questions, are for Ruth. So someone's messaged in to say, I'm worried about attending my appointment. Is there any support available for me?
There's lots of support available. Don't worry about ringing to make your appointment. All receptionists in all GP surgeries are more than happy to make that appointment for you. If you're worried about the actual appointment and going in and being with the nurse, I'm sure it's the same everywhere else, but here one of us will come with you. We won't look at the business end, I promise you. We'll hold your hand, we'll walk you through it. You can even, if you want to, make an appointment before you have your smear to come and chat to the nurse and have a look at the kit they use, look at the speculum, look at the brush that they use. Or is it a swab? It's the swab now, isn't it?
So rubbery
Yeah.
brush.
You can have a look at all the kit that they're going to use on your body, because it is your body. All you need to do is ring up. The girls, the receptionists at most surgeries will be very kind and will be very understanding if you're nervous and anxious. But we would much rather you came and you had your smears done. It's really, really important. It's free. It's free. The NHS in this country is really good at doing free screening for us all. So I feel that we should take them up on that. As I said, I'm more than happy to come and hold your hand. I know that a lot of receptionists in a lot of GP practices are also doing a non-medical training course to learn more about cervical screening and how they can support our patients. So we're really happy to do that.
I think you mentioned it earlier, but it's that point that the screening schedule is set at that 3 yearly frequency in women aged from 25 to 50, and then 5 yearly 50 to 65. And you should only request a smear if you've received your invitation or have received it a while ago but haven't made your smear. So
we very often get ladies ringing who say, I have had a letter but it was some time ago, and their mate will have given them a bit of a nag and said, come on, go and get it done. Don't worry about that. If you've received it a year ago, still ring us, because you still need to have your smear done. So give us a call. It's 01257 514056, and I'm going on the next telephone.
So you mentioned, Ruth, about nurses doing the smears. We have had a question in asking who does the smears. Is it a nurse or a GP? It's a nurse. It's a nurse,
yeah.
I know some GPs do them, but generally
it's a nurse. Some GPs will do them, and I guess that some ladies will have smears out of their schedule because they'll come along to a GP appointment. They'll describe some symptoms, and a GP may decide at that point that perhaps they're going to do an extra smear on them.
That's what happened to me yesterday.
There you go. So, but usually it would be a 20-minute appointment with one of the practice nurses at your GP practice. It's quite a long appointment, but there's quite a lot to discuss as well. And all practice nurses are well qualified and really good at making you not feel so nervous and anxious. As Kath said, it's their job. They're doing this day in, day out. And all they want for you to have is a healthy cervix, so come and get your smear done.
Yeah.
So I know we've spoken a lot about HPV throughout the conversation already. So we've had another question, and this one's for Kath. So do I need cervical screening if I've had my HPV vaccination?
Absolutely yes. So the HPV vaccination protects girls against the most common types of HPV, but screening looks for all HPV or all high-risk HPV, so it's really important, even if you've had your HPV vaccination, that when you get invited for screening that you go along, because that will absolutely guarantee you're going to be at low risk of developing cervical cancer.
Okay. So we've had a mum send a message in, and we have talked about this as well around under 25, so We might just want to re-emphasise some of the points that we've made, but my daughter is 21 and there's cancer in our family. Can she have a smear? That one's to you, Nick.
So, to our knowledge, there isn't any clear inheritable risk that means that you will be at greater risk of cervix cancer. So, the risk factor is exposure to the HPV, the human papilloma virus. So, if we take a smear, or if you attend your GP surgery or wherever you can get a screening smear, and a smear is done, and you are out of program, as in you are under 25 or you've had a smear within 3 years and you haven't had a request, when that smear arrives at the screening centre, it will be disposed and won't be processed, because it's a screening program, it's not a diagnostic test, and so they're very rigorous about adhering to that. So I think that if you have if your daughter's under 25, 21, if she has abnormal symptoms, they should be reported to the GP or practice nurse, and she should be appropriately investigated. But there is no evidence and no indication to have cervical screening because of that family history.
Okay.
The best way she could protect is that she's had the vaccine, and then when she turns 25, she goes to
Absolutely. If she hasn't had the vaccine, you can. There was an accelerator program, so.
But you can now get it up to the age of 25. So.
Okay. So yeah, and the vaccine. The HPV vaccine is given now at the age of 11, isn't it? I think
it's year 8, so about 12, 13.
So the vaccine will protect you against the most common high risk HPVs, and there is really good and growing evidence that it will have a very big protective effect, perhaps across more than just those HPV subtypes. But in the countries where vaccination was introduced before England, there is clear evidence that the incidence of cervix cancer is reducing, and countries such as Australia are starting to talking about the concept of eradicating cervix cancer, and I think we're just too early in our journey on that to know where we are, but it's a really brilliant
that's one of the
program.
Joe's Trust messages in some of the research they've done, that if we get to the rates of girls, people, because boys get it as well now, being vaccinated against HPV, and we get screening rates where they need to be, we could in the future.
Eradicate.
You're starting to see that in the press.
Yeah.
Can I just remind everybody that the phone lines are open till 9 o'clock. You can phone here even if your own surgery is closed, and we will pass your details on to your own surgery.
Okay. So we've got another question from someone who's quite anxious about attending for cervical screening and hasn't attended their appointment, but doesn't want to know if they've got cancer. So I don't know whether, Liz, you want to just share some of your experience and.
Yeah, it's a difficult one, because on my radar it was never a question of not going. I think my mum's always drummed it into me. I have waxing done, I've never been sort of concerned or worried about things like that, and I know a lot of women are. So obviously I went, and like I mentioned before, I was in a really, really rare case where my cancer was picked up from the cervical screening. And if you are worried or concerned about the outcome, all I can honestly say is that you're doing the right thing. Like, being afraid of a 5-minute test, it's just not worth your life at the end of the day. And like I mentioned before, everything's in place. The turnaround was incredibly quick for me. The longest wait I had was the 4-week wait between my cone biopsy and my MRI, but that was purely so that everything could settle down. Had I not had that, I probably would have been in for my hysterectomy a lot earlier. Obviously, any cancer diagnosis for anyone, whether it's yourself or your partner or a family member or a friend, is horrific, whether it's early or late. And it isn't easy, and it wasn't easy, and it still isn't easy in many respects. And we're still dealing with it, and it is a process, because although my cancer story was very short, gratefully so, my emotional impacts, having not been able to have any more children, and I'm going to be going through the menopause a lot earlier, and one thing and another, is I'm still having to deal with that. But I have a daughter and she's got a mum, and that is by far the most grateful thing I could possibly ask for. So if you are nervous or concerned about the outcome and about being told that you've got cancer, I mean, it's unfortunate, and I would never say to anyone, oh, you'll be fine if you go for your smear, or you'll be absolutely fine if you go for your colposcopy, because God forbid everything isn't fine, but know that you're doing the right thing, everything's in place for you, the support is incredible, and it's ongoing even when you've had your treatment, and you will, it will be okay, everything will get sorted.
For all cancers as well.
That's
know,
it,
for
absolutely,
all cancers,
I know.
We know that early diagnosis and detection has a better outcome than if you ignored it, and that goes for whatever.
Yeah, and
cancer as well.
Yeah, and like I mentioned before, I was delayed slightly because of being pregnant with my daughter, and it was still quite early. Even though it had only been there a matter of months, it was still caught very early, and therefore everything happened very quickly, and it was a bit of a whirlwind, if I'm honest. But I'm here, and that's what I would say, is to just do it, because the fear and the uncertainty, it really isn't worth it at all for what could possibly happen.
Thanks, Liz.
Okay.
The next question is quite a common question that we've had before, not this evening, but in Kath and I's role. So I am an LGBT woman, I won't need to go for screening. Do you want to pick that one up, Kath?
Yeah, so even if your partner is female, you're still eligible for cervical screening. There is still the risk that you could have been exposed to HPV, so if you've been exposed to HPV, then you've still got the risk, and it's about reducing, the whole point of the screening programme is to reduce your risk. If you are a female to male, I have to get it right, transgender person, and you've not had surgery to remove your cervix, you're still entitled or eligible for cervical screening, but you won't necessarily be called, because on the NHS systems, which are a bit archaic at times, you will be registered as male, so it won't call males for cervical screening. But if you speak to your GP, as long as they know you still have a cervix, they will make sure you can be invited for screening. Obviously, if you're male to female, you may be invited for screening, but you won't need it because you're never going to have a cervix.
Yeah, I think so it brings up the concept of how HPV gets to where it gets to is always a challenging conversation, and challenging to explain to your patients, challenging to explain to your students and junior doctors, to teach them how to explain it to patients, and lots of misconceptions. So whilst of course we would recommend using condoms to practice safe sex, condoms don't provide you with 100% protection against HPV, because HPV can be transmitted with any intimate contact hand to genitals, or a genital face to genitals. You can spread HPV like that, and then people say, well, where have I caught it from, and that, when did I catch it? Well, HPV, the other word that gets used to describe HPV is wart virus, and there's a whole family of wart viruses. There are subtypes that cause warts that you can see, and generally those aren't the subtypes that cause pre-cancer and cancerous change. But it is just something that's on our skin. You know, our skin is our biggest organ in our body, and it's there as a barrier, and it keeps things on the outside, and there are bacteria and viruses on our skin all the time. The cervix is just a part of your body that's at risk because it has a junction where it's not quite as tough as skin. So there are two different types of skin on the cervix, one on the outside of the cervix and one on the inside, the canal of the cervix that goes up to the womb. And it's a really dynamic bit of your body. The cervix, I have this great selection of teaching photos which I say to doctors and nurses when I'm teaching them, is this cervix normal or abnormal? And I show up a series of pictures of a cervix, and they go, oh, I'm not sure. But in fact, it's the same cervix from one woman through one menstrual cycle. And it just shows how, you know, through that on average 28-day basis, how much the cervix changes. And in that time, there's lots of cell activity going on, and that's why that bit of your body's at risk of abnormality. So it's a complicated one, but it can be there for a while. Your body can get rid of it. You know, always practice, you know, safe and healthy sex in terms of barrier contraception if that's the right thing to do. Don't smoke. That's another thing that's associated with your body being less good at getting rid of the virus. So
Your immune system,
yeah,
doesn't it?
so things like that.
So we know that there's a few population groups that are less likely to come forward for screening compared to the general population. And one of those groups is people with a learning disability, and uptake in these groups is often lower than the rest of the population. And we've had a question in from a carer. I don't know whether you want to pick this one up, Kath. So I care for someone with a learning disability. What is available to support me to discuss cervical screening with them?
Okay, so there's loads and loads and loads of resources for people with learning disabilities and their carers or families to be able to support them to attend screening. We have lots of easy read leaflets which can be more pictorial than wordy, which you can use. On the Joe's Trust website there's a fantastic section of all about learning disabilities that has a really good video that you can watch with your whoever you're caring for who's got a learning disability. The website, which I'll just show you, has a function called Browse Aloud, and I've printed off because I knew we'd, I don't know if you can see that. So if you see this symbol on a website, if you click on it, it will actually, there's a little button that says MP3 and it will actually read the website out to you. So if you've got somebody who can't read, particularly hasn't got a very good reading age, or who wouldn't be able to understand it, but they would understand it if it was spoken to them, you could get them to use that. Locally we've developed a toolkit called Me and My Lady Bits, which was developed by some groups of carers as well as women with learning disabilities to support them going to attend, the sort of questions they want to ask, the things that may make them anxious. So carers can use this, health professionals can use this, and patients with a learning disability can use it. So if you wanted to use that, just ask at your practice and they should have a copy, or they'll be able to get one for you, and you can just print it off.
Okay, so you mentioned Browse Aloud.
Oh yeah.
So we've had another question in from another population group that has a lower uptake to screening, so those where English isn't their first language. So the question is, English is not my first language, is the information available in other languages?
Yes, so the leaflet, so when you get your letter, obviously your letter is in English, and it has a leaflet in called about cervical screening. If you want that leaflet in another language, you can get it. You can either ask at your practice and they can print it off the internet for you, the PHA website, or they may have some hard copies. You could just Google it and you would find it quite easily in whichever language you want. But again, the Browse Aloud function, so as well as being able to read the website to you, it will click you click on it and click language, it will translate the whole of the Joe's Trust website into whichever language you choose. If you can't read your own language or English, then again it will read it out in whichever language you've chosen, so that's a really good resource. But if you're not sure and you want information in your own language, just ask at your practice and they will be able to, or get one of your relatives to ask if you're not able to do that.
Thanks, Kath. So the ladies turned up for a screening, the screening test gone off to the lab, and now we've got a couple of questions about results. So Ruth, do you want to pick these up?
Yeah.
So the first one is, how long do my results take to come back?
The results are usually received within 2 weeks. Occasionally they can take a little bit longer, and that's not because there's anything wrong with them, it's just the amount of tests that they're testing.
Especially after this week.
Yeah.
Well, hopefully.
And also you will receive a letter, so your practice receive a letter and you receive a letter. If you haven't received a letter 3 weeks after you screening, you must contact your GP surgery and they will chase that up for you. So it's really simple. If you've not had a letter after 3 weeks, give us a ring and we'll chase it up for you.
I think that the system for abnormal smears is incredibly robust because it in fact removes that responsibility of communicating or organising the next step. If you have an abnormal smear, we are contacted by the lab that's read the smear. So there are so many fail-safe mechanisms, it's incredible. So we receive a list of women who we need to make appointments for. We actively make those appointments or provide choice about when those appointments can be. If the appointment isn't convenient, we can work around people's diaries. You know, over the years it is now, isn't it, Kath and Kerry, that we've been looking at decreasing smear participation rates, about how we were going to increase that. We thought we were going to. There's been talks of having, vans in car parks, providing mobile screening, pop-up screening.
Yeah.
But anyway, once you've had your smear, that's often what I say. Attending for your smear reduces your chance of having cancer significantly, and the system is really robust.
Yes.
So the next question we've had in is, who looks at the smear results when they come into the practice? Is it the GP or the nurse? Or?
Well, we get the result from the lab, and that comes in, and the GP will get that letter, and then the administrators will scan that letter to your records. So it's a really simple process, and at the same time that we get the letter, you will have had your letter, so you will know that we've got that letter because it will say on there that a copy's gone to your GP.
And there are things like results letters aren't sent on a Friday, so there's always people available.
Yeah.
If you have questions.
Questions. And again, if you get your results letter and you have any, I know that ladies who've had results letters who need colposcopy are also contacted almost exactly at the same time by colposcopy. But if you get your result letter and you've got any questions or any queries, any concerns or worries, please ring your GP practice, and you can ring us till 9 tonight to make that appointment, so I hope you're all ringing.
So Nick, another one about results, and you have picked up on this a couple of times, but it's just to clarify. So what happens next if my results are not negative?
So if you have an abnormal result that needs referral to the colposcopy, that will come to us automatically. So as a direct referral from the smear reading laboratory, and as we said before, they're prioritised. So the high grade smears are listed within 2 weeks, and the low grade smears definitely within 6 weeks. And we will make contact with you to organise an appointment. Sometimes that is sending you an appointment, sometimes that's providing you with the ability to phone up and alter that appointment. always you can change the appointment if it's not convenient. When you've received a letter from us, there'll be a contact number. Our telephones will be answered during office hours, and if you leave a message, we will call you back. We have text reminder services, so if you do have an appointment with us, we'll send you a text reminder. So you will then come into our system. You will have the colposcopy examination as I described earlier, and then we will I may say you don't need anything done, it's normal, have a smear in 3 years, or I may say I think there's a mild abnormality, but it's likely to get better on its own, so have a smear in 12 months, or I've taken a biopsy, or we've done a treatment, as I said. And so if we've taken a biopsy, we'll write back to you within 4 weeks. And as I said, if you haven't had that letter within 4 weeks, then you can phone up and moan about me. If you've had a biopsy, we will then provide you with a plan to say it's normal, you don't need anything done, or it's abnormal, this is what you need doing. And if you've had a treatment, then 9 times out of 10, the letter will say, you've had a treatment, it's found what we expected to find, you've had treatment to your precancerous cells, I believe that they're now all gone. Your next smear will be in 6 months with your GP, okay? And we call that the test of cure smear. And at that time, we're checking to see that everything's gone back to normal. And if the HPV has been eradicated, then we know that the slate is wiped clean. You're starting from normal, so your next smear is in 3 years. So that's what.
At that point, you will write to us, and we will put a reminder on that patient's system, and they will automatically get a letter to tell them to come in and have a smear. I mean, I want to be a bit more proactive than that. I think I should just send them the appointment for the smear, but we don't do that. But we can do.
No, it's difficult scheduling.
Yeah.
Because people take holidays and people do this and people do that. So
I think as
They
well,
have lives, Nick.
I think as well, just to remind women that very often at your practice, your smears will be earlier in the day, which is more helpful to us all. And perhaps later in the day, try and avoid working times if we can. I know at our practice we offer smears at weekends as well. I don't know about other practices, because I'm acutely aware that people do have busy lives, they work,
and we run some evening colposcopy too.
So
I think if you do work, it's not always easy to say to your, particularly if you've got a male boss.
Yeah, I've got to go.
I've got to go.
So
Okay, so the next question is probably for you, Nick, again. It's probably a common question that you get asked. So I had a hysterectomy 20 years ago due to cervical cancer. I'm always concerned that I don't have screens anymore. Can it return? It's been a long time since I had a smear.
So we'll kind of go if you've had cervix cancer and you've had a radical hysterectomy as your treatment, then the definition of the radical hysterectomy is that not only do we remove the cervix, we remove tissue around the cervix, including some skin from the top of the vagina. So all the potential area is removed and there's no cervix left to smear. So you're left with the skin of the upper vagina, and there's no evidence that continuing to take smears from the top of the vagina after treatment for cervix cancer with a radical hysterectomy is going to alter outcomes. After treatment, you're seen regularly and examined and kept a close eye on, and lots of that is about making sure that the diagnosis or the treatment hasn't caused you any problems, as well as making sure the cancer hasn't come back. So it's about making sure that I haven't caused you harm, and dealing with that. And as you kind of referenced, psychological things.
Yeah, sure.
So that's what. So follow up for cancer treatment is not just about making sure the cancer hasn't come back. It's about a whole package of
Yeah,
things.
it's really great support that we've had. So yeah, it's all good.
But after, if you have a hysterectomy for a non-cancer reason, then sometimes you do need smears from the top of the vagina, but that's done in the hospital. It's not done at the GP surgery. So there are some situations where you may have a smear afterwards if your smear wasn't normal before your hysterectomy, but not if you had cervix cancer. And sometimes very, very, very early cervix cancers can be treated and leave some of the cervix and the womb behind, and they will continue to have smears initially done by the hospital, but then at some point can occur back with a GP.
Okay, we've probably got about 5 minutes left. Still lots of people watching and still questions coming in. We've got a couple more questions to answer. I'm not sure who wants to take this, maybe you, Kath. I've seen on the news that home testing will soon be introduced. Do we know when this will be?
No. So there is a couple of trials about home testing that are taking place at the moment, and up to now the results are looking promising, but it's likely to be quite a few years before it's introduced as part of the routine screening programme. So really the message is it's probably coming, but please go for your screening when you're invited for the time being until that comes in.
Okay, thanks, Kath. Right, we're down to the last question that we've had come in tonight. So, probably one of the most important questions of the night: how can I reduce my risk of cervical cancer? Liz, do you want to?
Yeah, of course. So have your HPV vaccine when you're at school, and when it's offered to you, you need 2 doses. And do they happen at the same time, or
No,
are they
they have to be more than 6 months.
Right.
So you have your first one, and then after 6 months.
And they will. I will assume they'll come back to the school and do it anyway.
So the
So
school
it's
programme, the school immunisation programme.
yeah, it's all organised for you. So it's all at the school. So all you need to do is just get it done. And then when you get to of age, generally you'll get your letter. You're like 24 and a half, really. You get it sort of 6 months before you turn 25. So as soon as you're 25, have a birthday day out on your 25th birthday. Just go and get it done. And just keep going when you are invited. Please don't push it to the back of your mind. Just call up, get it done. It's 5 minutes of your time. The fact that it's available at weekends is amazing. There's no excuse, basically, and that's one of the biggest ways you can reduce it.
And if you're worried or anxious, we'll hold your hands, we'll tell you jokes, we'll make you laugh, we'll do anything, just come and get your screening
look
done.
after the children.
Yeah, we'll look after the little
that's
ones.
another
Bring your
thing.
little ones. I love looking after
Yeah, we even do that in the colposcopy.
Yeah. I've done that a few times. I've had somebody looking after children.
Absolutely.
So thanks, panel. So I think the main take-home message for tonight is that cervical screening saves lives.
Yeah.
It is.
Cass, do you want to round up and give
So-
us the number one last time?
Yeah, so thank you for joining us for this Facebook Live, to the panel for all your input, to Library House Surgery for hosting the event, and the Chorley Central Primary Care Network, who are cross-posting or streaming, I'm not quite sure what the terminology is, and also Bay Medical Group, who are also cross-posting. The telephone lines are going to remain open if you want to make an appointment or if you just want to chat to someone. Until around 9 o'clock this evening, and the number, in case you forgot, is 01257 514 056. If you have any questions we haven't answered, please comment on the Facebook pages and we will endeavour to answer these in the next few days. If you need any support about anything we've discussed, the information is available on the Joe's Trust website, which is joestrust.org.uk, and they also have a helpline if you need to speak to somebody or you've got any concerns. If you found this evening useful, please feel free to share it on all forms of social media. Thank you very much. Goodbye.
Well done.